What are emerging therapies for sickle cell infection prevention? Living with sickle cell disease can be challenging, especially when it comes to managing infections. Emerging therapies are focusing on reducing complications that can lead to infections rather than directly preventing them. One of the most exciting advances is gene therapy. For instance, CRISPR-based gene therapy, known as Casgevy, edits a patient's own stem cells to increase the production of fetal hemoglobin. This helps prevent red blood cells from sickling, which can reduce the frequency of painful crises and, in turn, lower the risk of infections. Casgevy was approved in 2023 and has shown promising results, with some patients experiencing months without vaso-occlusive events. Another emerging therapy is lentiviral vector gene therapy, called Lyfgenia. This treatment enhances hemoglobin production in red blood cell precursors. Clinical trials have shown that many patients experience fewer or no vaso-occlusive crises, which can also help reduce susceptibility to infections. Like Casgevy, Lyfgenia received regulatory approval in 2023. Modified bone marrow transplantation is also making strides. This newer approach uses related donors and has shown high survival rates with fewer complications. By curing sickle cell disease, it eliminates the chronic problems that often lead to infections. However, this method is still limited by the availability of suitable donors and the risks associated with transplantation. Hydroxyurea, an established treatment since 1990, remains a frontline therapy. It reduces painful crises and hospital visits, indirectly lowering infection risk. Hydroxyurea promotes the production of fetal hemoglobin and has a strong safety profile. Other approved treatments, like L-glutamine, also help manage complications but are not specifically aimed at preventing infections. While these therapies primarily target the underlying issues of sickle cell disease, they help lower the overall vulnerability to infections. Standard infection prevention measures, such as vaccinations and prophylactic antibiotics, continue to be essential for patients. Currently, there are no direct therapies specifically targeting infection prevention beyond these disease-modifying treatments. Research is ongoing to find more accessible treatments that can be widely applied, especially since sickle cell disease affects many people globally. The most promising emerging therapies focus on reducing sickling and its complications through gene editing and improved transplantation methods. These advancements aim to improve overall disease control and, consequently, lower infection risk. Patients should always consult healthcare professionals for personalized advice and continue following established infection prevention guidelines.